So let's talk about infarction. So by definition, what's infarction? Infarction is irreversible cell death or necrosis caused by prolonged ischemia from vascular occlusion. And remember what we discussed under necrosis in the previous lecture, we said anytime you have loss of blood supply or ischemia to any particular tissue or organ in the body, classically you're going to get what? Coagulative necrosis. But the only exception is in the brain. And what we see in the brain is going to be what? Liquefative necrosis. And guys, if you've not watched those videos on necrosis, please do watch those videos. It's going to help you. So moving on, what are the factors affecting the likelihood of infarction? So in other words, if there's ischemia to a particular tissue or organ, what are the factors that will most likely predict that this tissue may develop infarction? Because it's one thing to have ischemia, it's another thing to develop what? Infarction, which is cell death. So let's look at them. So one is the size and the number of occluded vessels. So if you have a very large vessel or multiple vessels that have been blocked, then that increases the risk of ischemia or leading to infarction. A classic example is sudden pulmonary embolus, whereby somebody had a big pulmonary embolism and which could lead to sudden death, right? Because with big pulmonary embolism, that will suddenly increases the right-sided afterload, and that will make the cardiac output to be equal to 0, and that patient could die. And then the next one is collateral circulation or dual blood supply, which is what we saw in the question earlier. So the more collateral flow, the lower chance of infarction, because even though if one is blocked, they will still be getting blood from other collateral circulation or other blood supply. And so high infarct risk organs with end arteries, right? So example like kidney, spleen, they only have one artery, right? So only one artery. And because of that, these tissues are more prone to what? Infarction. Lower infarct risk, those are organs with dual blood supply, like we mentioned. In the case of lungs, so with lungs, we have the pulmonary and the bronchial arteries. As opposed to the liver, we have the hepatic artery and the portal vein. So that's why the lung, the liver, they are less prone to infarction. As opposed to the kidney and the spleen, whereby they have the end artery or single artery, they are more prone to infarction. Very good. Moving on to the next factor is oxygen demand of the tissue. So if the tissue has a very high oxygen demand, that increases the likelihood of infarction to occur. And this tissue includes the heart and the brain, right? Remember, the heart is constantly pumping and the brain is constantly working, right? And the next one is pre-existing tissue damage. So if somebody already have a tissue that is already been damaged, they may not be able to tolerate ischemia very well, and that could lead to what? Infarction. A classic example is a patient who have chronic obstructive pulmonary disease like emphysema, or a patient who have interstitial lung disease that now develop pulmonary embolism, then that could lead to what? Ischemia and infarction, because those tissues are already been affected, damaged, or diseased, and they may not be able to tolerate ischemia very well, and that could lead to infarction.